I feel like you have such an important role right now because even more so after last year in regards to retaining students, because, you know, you're seeing, like, you still work in the hospital and you're the ones teaching this new batch of students. I mean, do you feel like your role has, as an instructor, like shifted at all? Being like, it's a wonderful profession. Like, still, I know it looks bad.
Being an educator right now it's challenging. We have to be more adaptive. We have to be more innovative, creative, because we are teaching in an era of a pandemic right now. You're also dealing with students that could be having a lot more going on, right? And you have to be creative in the way that not that you were not creative before, but now, you know, you have to,
forced
exactly,
to be
even more so now, that we have to teach under these kinds of modalities. So absolutely, that's been a challenge. But, you know, the beauty of being an educator and a clinician is that, you know, I get to live in both worlds. And these worlds, you know, they're codependent on each other. Right? So educators, we are relied upon to graduate competent nursing graduates, right? To go into the workforce. Our stakeholders, health facilities and organizations are dependent on us to graduate competent nurses. And then on the other hand, we're also dependent on them for clinical sites, right? To train these students, and then also for job offerings when they graduate. So there's that codependence going on. And then as an educator, as an individual, I love that I'm both an educator and a clinician, because being a nurse clinician, I get to keep my skills going. And that's part of what I like about being a float nurse, is that diverse experience. I get to bring that back didactically to the classroom, share my experience with the students. Students love that practicality when you're able to, like, tell them real life stories, right, that are relatable to the topic and all that. So it's really good. I love it.
I feel like you're a great person to bridge that gap between what you teach in textbook and then clinical, you know, your clinical experience. Like, have you gotten into situations where you've disagreed with what the textbook says and you're like, okay, am I going to teach them what it's really like, or if I'm going to stay with the textbook?
Oh yeah. And these students are so smart, and we're getting more and more diverse group of students from different backgrounds. And by backgrounds, I mean educational and different racial backgrounds and so on. So they're all unique. They're coming to the table with different background experience. And of course, you know, the challenges are there, but it's also nice because they're bringing a lot to the table. And I'm telling you, if there's a discrepancy in the textbook, they're pointing it out to you like, hey, professor, what's with this statement over here? And as you know, textbooks, there's sometimes errors that happen.
Yeah.
So as faculty, it's important, just like in the clinical realm, right, Maggie? We need to always stay professionally competent through continuing education. And as you know, nursing is based on evidence-based practice. So as educators too, we're always staying as on top of things, right? Current as possible. So absolutely making sure that the information in the textbook is as up-to-date as possible. We don't recommend textbooks that are beyond 5 years to students.
Sure.
And when there's a discrepancy, we definitely address it, let the students know this is not correct. It could be a typo or whatever. And even sometimes referring to the publisher.